So it's springtime and we're all out and about a lot more these days. And there comes these awkward stings and bites, and I get a lot of calls and asking, is this normal? What do I do with it? I'm Zeinab. I'm the pharmacist from PillSorted. So first I'm going to go through what's a normal reaction to a sting and bite, what it looks like when it's an allergic reaction, and how do you understand when it's infected. Then I'll go through the common insect bites and plant stings in the UK and what's the best way to treat them. Okay, so that's the flow of this video. Now, for a normal reaction to a sting and bite, what you see is a localized stinging and feeling itchy and quite red, and it comes within minutes and hours. So when I say localized, I don't mean it's going to be a tiny pinprick sort of thing. It might be as big as a 10 centimeters. So a bee sting can be quite a big localized reaction. But the important thing is it shows very fast and it usually subsides within hours. The allergic reaction is not just limited to the local area. So if someone's allergic to a bee sting, it won't be only the sting area that will get red and swollen. You will feel the whole histamine cascade. So that will mean swelling in the mouth, difficulty breathing, feeling dizzy. All of those allergic reactions that we talked about might happen. So that's an allergic reaction. It can happen with any of the stings and bites that are out there, but they're usually quite rare. So they're less than 2%. In the case of infection, when we have that normal reaction to a sting and bite, which makes it red and itchy, if someone scratches it, which usually happens with the children, is because it's so itchy, they scratch it, but that scratching breaks the skin. And when the skin breaks, there's a chance that the infection goes in. So that sting area, after a couple of days, you'd see within like 1 or 2 days, you'd see the redness and itching become worse actually. So it gets redder and hotter. It might have some oozing discharge from it, and it will have yellowy crusts around it. So these are signs of an infected bite and sting area. So what are the common bites and stings here in the UK at this time? There's mosquitoes and midges, and these are most common on the long summer nights in the evening time and close to water. That's where they usually bite the most, and it usually is a small red itchy bump. In children, the reaction is much bigger because they haven't built up the tolerance towards the mosquito saliva actually, but I used to joke with my children that they just taste sweeter. So children will have a bigger reaction. The other usual stings is bees and wasps. So bees are rounder and smaller, and they usually leave their stinger in the stinging area that they've put. So there's a tiny little peck that you see. Wasps don't leave their stingers behind. They're taller, they're bigger, and they might sting a couple of times back to back. They're very, very sharp pain, makes a lot of redness and swelling. So if the stinger is left behind and you want to take it out, you just need to very gently brush it off. So you don't want to squeeze it because that squeezing will release more venom into the skin. The last insect bite that I want to talk about is tick bites. So ticks are these tiny little insects, but you can see them. So they're like tiny little dots. They're usually in the long grass or the woodlands, and if you see this tick, you want to remove it with the tweezer or with your fingers, but you need to pinch as very close to your skin as you can and pull the creature off so that it all completely comes off your skin, because they latch in really hard. They can be carrier of Lyme disease. So how do we understand Lyme disease? Lyme disease is quite widespread actually in the UK, and how it shows is within a week up to 4 weeks, you'll see a very distinct red patch that has got like a bullseye red in the middle as well. So it's quite distinct the way that it looks. Most of the time it might be that you just miss out the first tick bite that happens, and it's easily treatable, so it needs antibiotics, but because it's quite common, it's important to keep an eye out if you see this pattern. Now, plants. What are the most common plants these days? Nettles is one of the most common ones. There's quite a lot of them. They're quite pesky. What they do is they inject histamine directly into your skin, so they cause that redness and itchiness. It usually clears up pretty quick. There is another one that's quite common, is called the giant hogweed. So in the giant hogweed case, the thing that you want to avoid is the sap. The sap might look like a clear water, but when it touches your skin, it will make a big burn. For that burn, you really need to be mindful for it not to see the sun. Okay, so cover it properly. That's the important thing that you need to do. Okay, so how do we treat them? What are the most important things that we can do? The best things that you can do is, if you have a sting and a bite happen, make sure you wash it, because the sooner that you get it under cool water, it will help cool it down and it will help get more of the irritants off your skin. The other thing is cooling it will help, and antihistamine. So antihistamine tablets are great, even if it's a normal bite that doesn't seem like an allergic reaction. That antihistamine helps your body recover from it faster. There are topical creams as well. So the anti-Zeinab that I've shown before, if you check through our allergy series, it's got a good rundown of all the different treatments that are for the allergies. But there's antihistamine cream that's really useful. There's also hydrocortisone creams as well, so that'll help your skin calm down, the redness and swelling to go. There's also creams like Savlon. It works like a mild antiseptic, so it will help keep your skin clean and prevent infections from happening. And the other thing is, wearing long sleeves and long trousers is a good idea, because it will prevent these inadvertent stings and bites happening. Also, the insect repellent sprays like the DEET, or the more natural alternatives for them, like the Citridiol. These are good things to have with you, because a spray or two will repel the insects from connecting themselves to you. What do you need to look out for? If you see any signs of an allergic reaction, in that your lips and face become swollen, you find it difficult to breathe, those are the ones that you need to call urgent emergencies. If you see that the area is not getting any better, but it looks really red and hot and any discharge from it, again, it's the time to reach out to us. We can offer you antibiotics via the pharmacy first. If there's any questions you've got anytime, we're here for that clinical pharmacy-led advice. Thank you.